end of life takes on a whole new meaning when patients are able to live at the newly established Maison Valley Inco Hospice. In this caring environment, the focus for those who enter, regardless of age, is living with dignity.
People want to die close to home, and they shouldn't have to go somewhere else when they're last stages of life. And Sudbury is a center of care in Northern Ontario, so it was important that Sudbury had its own place.
In Sudbury alone, 1,200 people per year are in need of hospice palliative care. So that statistic alone is what drives him.
The average stay in Ontario and in Sudbury is the same, is about 22, 23 days. So we've had stays of as long as 7 months and as short as 38 minutes.
More than 150 people have passed through this 10-bed facility since opening in 2008. Executive Director Léo Therrien cares for the hospice patients as though they are family, in an environment where the goal is to offer a place as close to home as possible for those on their final journey.
He's not a director to sit behind a desk and do budgeting. He's the director that's in the rooms with the residents and the families and talking to volunteers and helping staff through their journey. So he's just really involved in all aspects of palliative care.
Léo has been appointed to the Board of Directors of the Hospice Association of Ontario, where he is striving to lobby the Ontario government to adequately fund hospice palliative care. The hospice currently receives 40% of their total costs, while other not-for-profit gets 80%.
So he's taking our local success story, which is hugely successful, and bringing it to the provincial level so that other communities in Ontario will benefit with the fact that we've had very generous partnerships with government, and we've been able to get corporations and unions and others to work together to make this very important hospice a reality, not only for Sudbury, but for Ontario.
The hospice does not ask for money from patients or their families, but must raise $600,000 annually, fundraising efforts that Léo Therrien is happy to soldier through, so hospice residents can live their final days without the burden of paying for end-of-life care.
People know that we took care of them, that we took care of them from birth to the last journey. So that the hospice played a role in the community by looking at life and death in a different way, that death is a passage, that we live till we die, that we should take care of each other until the end journey.
I would call him Pierre Aguilera because he is truly a cornerstone for our community in care, in commitment, and in compassion.
Congratulations to Léo Therrien, winner of the Community Builders Awards of Excellence for Healthcare, sponsored by McQueen's Furniture.